All right. So the in-service today is going to, it's going to concentrate on all the various cancer treatments, the side effects of these treatments, with a concentration on nutrition. We're going to touch on how to screen and assess our inpatient and outpatient oncology population and determine what our course of action will be once we figure a patient is going to be at nutritional risk. So why is proper nutrition screening so important for our oncology patients? Cancer has a direct relationship with nutrition status. Poor nutrition status in cancer patients is inversely associated with survival rate. 50 to 90% of cancer patients experience weight loss, and the prevalence of malnutrition in cancer patients is greater than 70%. And that's more than our AIDS patients, our renal patients, and our liver failure patients, so it's quite high. An overweight or obese patient can still be in a malnourished state. They can still be at nutritional risk. So don't just go by whether the person has a healthy BMI. We really need to get that full, go through all 4 questions, because if they've had really poor nutrition status, they've had really poor PO intake for greater than 5 days, weight loss, as little as a 5% weight loss can have, can put these people into the malnourished group. So some cancer treatments can even cause weight gain. So that's when the dietary intake becomes more important. Breast, prostate, and ovarian cancer treatments cause fluid retention, and a lot of times these patients are on certain medications that will make them gain weight, but these patients can still be malnourished. So if they've gained weight, it doesn't necessarily mean that they're healthy and they're doing great through their treatment. We really need to find out what their dietary intake information is. So as far as the physical assessment, we want to take notice of muscle wasting, body fat loss. We want to look at the temporals. We want to look at the clavicles. We want to look to see like the fat pads under the eyes. Patients who have lost a lot of weight, they'll have a hollow eye. We can test for grip strength, and then that can ascertain that the patient has experienced weakness. Weakness and fatigue go hand in hand with malnutrition and impaired nutrition, an impaired nutrition state. So the physical assessment, although technically part of the nutrition assessment performed by the RD, the nurse is the first one to set eyes on this patient. So that's, really utilize this time to do a brief physical exam, look for bony prominences, like I said, the hollow eyes, any sort of protruding clavicle, look for skin pallor. We want to look to see, is their skin dry, etc. So when we're obtaining a weight history, as little as a 5% weight loss can cause a reduced response to cancer treatment. So a 5% weight loss in a person who's 150 pounds is only 7.5 pounds. So you can see it's really not that much. Some cancer patients will lose that in a week. For weight loss to be considered malnutrition, the time frame would have to be less than a month or equal to a month, and needs to be paired with a certain percentage of reduced oral intake, physical findings such as loss of subcutaneous fat, muscle loss, and or fluid accumulation. So tips for our surgical patients. Pre-op, we want to choose low-fat foods that are easy to digest. After recovery, drink plenty of decaffeinated beverages to prevent dehydration. We want to encourage small, frequent meals and snacks throughout the day, and include high protein foods at each meal and snack. And I've listed some of the higher protein foods. So in addition to the animal proteins, we have nuts, seeds, legumes, beans, wheat germ, nut butters. Those are all plant-based protein foods. So there's options for those vegetarians out there. We want to include foods high in vitamin C, calcium, magnesium, and potassium to aid in the healing process. These foods are found in all our fruits and vegetables, dairy foods, iron-fortified cereals, and our lean proteins. So external beam treatments and side effects for head and neck cancer. Head and neck cancer can cause internal and external mouth redness, irritation, dryness, oral secretions of thick mucus, pain, changes in taste, and difficulty chewing and swallowing. Radiation to the chest can cause soreness when swallowing, heartburn, and esophageal reflux. To the abdomen, therapy is specifically the liver and pancreas can cause nausea with or without vomiting, and to the lower abdomen causes diarrhea. And then to the pelvis, we see changes in bowel habits, including diarrhea, abdominal cramping, gas, bloating, and intolerance to dairy in particular. So tips for these patients. Radiation therapy can be anywhere, it can last up to 5 days a week for hours each day. So it's important to encourage these patients to plan ahead. They can bring snacks and beverages with them to treatment. If there's a microwave available, they can bring soups, stews, broth, especially if they're not tolerating anything really solid. They could sip on some nice broth while they're getting, during these times when they're there for so many hours. And we always want to make sure we utilize safe food handling. We want to refrigerate the foods that aren't being consumed right away, and we want to heat foods to their proper temperature. So fatigue is a really common side effect of chemo. So we want to encourage intake of fluids, as dehydration can exacerbate feelings of tiredness. Recommend medications that may help counteract feelings of fatigue. Encourage a balanced diet to help increase energy. And help the patient prioritize daily activities by recommending to only do the most important activities on the days they feel best, and to schedule daily rest times. Have the patient plan ahead and prepare meals and snacks in advance on the days when they're feeling well. Always have a variety of clear liquids on hand for the days when their appetite is poor and they have nausea. Have the patient eat a light meal before treatment to help prevent the post-treatment nausea and vomiting. On the days when the patient is feeling their best, recommend eating their favorite foods to help prevent food aversions. So on the day when the patient's not feeling very well, that's not the day to be having their favorite meal, because if they get sick after that favorite meal, they're never going to want that meal again. So for these patients, hormonal therapy can cause fluid retention, hot flashes, mood swings, increased appetite, and weight gain. Hormone therapy has also been linked to have negative effects on the cardiovascular system, so a healthful diet rich in plant-based foods is even more imperative for these patients. Soy products should be avoided if the patient has an estrogen receptor positive cancer like breast, ovarian, or endometrial cancer. Increase low-fat or fat-free dairy products, or include more leafy greens that are rich in calcium to help retain bone mass and density. Decrease the use of salt to try to prevent that fluid retention. Pay close attention to portion sizes to help prevent further weight gain. And have the patient confer with their oncologist about safe ways to include daily physical activity to help maintain lean muscle mass, promote bone health, and burn extra calories. Our tips for these patients are eat small, frequent meals high in calories and protein. If nausea or vomiting is present, take small sips of clear liquids until the symptoms subside. Encourage the use of an anti-nausea med, and offer an appetite stimulant once nausea and vomiting have cleared. So when we're looking at who are these patients that are considered at nutrition risk? So we're looking at people who have greater than or equal to a 5-pound weight loss in 1 month, greater than or equal to 2-pound weight loss in 1 week, 1 to 2% weight loss in 1 week, or a 5% weight loss in 1 month. So it's little calculations we do. If the person says, well, I've lost 6 pounds in the past month, you do a little calculation to figure out what is that as far as percentage-wise. So I'm going to start talking about some of the other side effects and just go into a little more detail, because these are the ones that we see most common. So persistent nausea and vomiting, we see this all the time with our chemo patients. The effects on nutritional status are dehydration and electrolyte imbalance, loss of appetite, poor intake of food and fluid, and food aversions and weight loss. So it's a doozy. These are the ones, we really want to try to stay on board with the anti-nausea meds, A lot of times we have people taking their anti-nausea med, 2-3 days before they start their treatment just to kind of get it into their system and try to prevent these kinds of problems, because it really is just a snowball effect when these patients have this persistent nausea and vomiting. So our strategies for tackling nausea and vomiting are we're going to eat small, frequent meals and snacks. You go without eating for a long time, sometimes that feeling, that hunger feeling will actually start feeling like a nauseous feeling. Try cold foods, ice chips, dry foods, and room temperature foods. Drink liquids between meals to help avoid feelings of fullness. So rather than having this huge glass of water with our meal, we're going to eat our food so we can get the most bang for our buck from those calories and protein and vitamins and minerals, and then we'll have our drink afterwards. We want to avoid greasy, fatty, spicy foods, foods with strong odors, sweet foods, really hot foods, and pharmacotherapy with anti-nausea meds and our antiemetics. Of course, we just talked about that. Mucositis is a side effect we see with head and neck cancer especially, but we see it with all sorts of other cancers as well. For someone with this issue, we want to select soft foods, avoid acidic, spicy, and dry foods. We can use a straw to help with the swallowing difficulties, and use cold, high-calorie drinks and or medical dietary supplements. As far as taste alterations, some cancer treatments can cause a bitter and metallic taste in the mouth. Some patients report that they have aversions to meat specifically. Reduced ability to taste sugar and salt. And on the other hand, we've had patients that say everything they eat is salty, including plain water. We just had a guy recently who he was having a really hard time eating because everything was so salty to him. And so our strategies for these people are we're going to use tart and sour foods, and that helps reduce the metallic and bitter tastes in the mouth. So we've even had doctors order on people's trays when they're inpatient lemon wedges with every meal. So the patient will actually suck on the lemon wedge prior to taking their meal. So we're going to season food with herbs and citrus versus salt or seasoned salt. Foods at room temperature or really cold sometimes are better tolerated. Using plastic utensils and silverware versus silverware can help with that metallic taste. You can also prepare a homemade alcohol-free mouthwash using water and baking soda. There's also products on the market like Biotin. They specifically designed to help with dry mouth, so rinsing with something like that prior to eating can sometimes help. Constipation we see a lot with our cancer patients, especially when they're having, they have a GI cancer. Constipation is a common side effect, especially when they're taking the opiates, because we all know that those cause constipation. So it's kind of like, you start treating the person for their pain, but then all of a sudden you're starting to having to treat the person for their constipation, so you're kind of putting the medications all on top of one another to counteract the other side effects. So our strategies for patients with constipation are choosing high fiber foods, except for those individuals with mass obstructions. So we don't want to give someone a high fiber diet who has an obstruction, obviously. Drink plenty of fluids. Try and be physically active, because that being physically active increases your metabolism and in turn helps with motility. Avoid or limit gas-forming foods and beverages, and these are as followed. These gassy vegetables like broccoli, cabbage, Brussels sprouts, asparagus. Fructose, which is found in artichokes, onions, pears, and soda. Lactose, which is the natural sugar found in milk, and then soluble fiber found in fruits, oat bran, and peas. So fatigue, regardless of the cancer site and type of cancer, fatigue is usually always present. Side effects are usually most prominent around the second or third week of treatment, but this also varies greatly with each patient. It's important to prepare patients for these side effects well before the treatment begins, to provide them with tips on how to treat these side effects. And also just kind of prepare. Prepare for these bad days when you're just feeling really, really tired. There's nothing in the kitchen. There's, nothing to drink. Just kind of have everything in place